Wrist fracture, mainly we talk about the distal radius fracture. It's a big part of the hand surgery practice. And distal radius fracture we can categorize to the different population because of different reasons. In the winter, because of the weather, snow, and also most common thing we see is older female people because of the osteoporosis base of the quality of the bone. So it most common happen in the senior population and affected because of the postmenopausal osteoporosis, poor bone quality. But in the summer, and we have more of the distal radius fracture actually associated with the sports and specifically with dirt bike. It's very popular in here, and also some car accident. Basically, it's associated with the higher energy of the injury and also the younger population. The treatment for them basically is very similar, but also is uniquely different. For example, for the senior population, because we are dealing with the age, it's more senior, so we look at the function level of the person, and not only the age, because somebody maybe they are a little bit older, but their function level actually is pretty good. We're more aggressive on this kind of the treatment. I mean aggressive is that more like an internal fixation to make it more close to the anatomic position. And for the sports related, that's because of the higher demanding of the job, and so we go more of the operation treatment. And I did quite a few years of the osteoporosis research in my early years, and basically it's a bone histomorphometry associated with the postmenopausal osteoporosis and the bone physiology, so I'm interested for the senior population group. And our state of the Iowa, we have a higher percentage of the senior population, and especially the female, and also we have a long winter. So we have a lower exposure to the sunlight, so the vitamin D level is another concern. And also from genetically, and the Caucasian female always as a group, it has a higher risk of the postmenopausal osteoporosis than the counterpart of the African American group. So that's the reason we have so many of the distal radius fracture in the winter, and because when you have a slightly slippery and you can break the wrist. And I've been here 17 years in state of Iowa. I love it, but we do see a lot of this kind of the patient, and we develop a very good program now in here, and we combined the occupational therapy and also the surgery, and we evaluate the patient preoperatively and arrange all this therapy program. And also for the surgery, we let the patient start the therapy right after surgery. Majority of people actually recovered very well. You treated the patient differently based on the non-surgical and the surgical. It's a judgment call from the surgeon. And mainly we look at it is that two questions. Number one, is this patient with a significant interruption of the joint surface? Displacement. It's how far this fracture made the bone structure shy away from the normal structure. If it's very bad displacement, you have to do it surgically, because you need to reduce the fracture. And second is that when we do the true surgery and the conservative treatment, it's based on the patient demanding level and the patient medical conditions. For example, if the patient is a very senior population with a lot of medical problems, we may not want to treat it surgically, and we want to treat it conservatively. Most of the patient, older patient, because when the bone quality of the bone, so when they got the fracture and they do have this deformity, and specifically if they have an interruption of the joint surface, and the joint surface is supposed to be very smooth, covered with cartilage. If they destroyed this part, and you're going to develop a lot of arthritis. Not only arthritis, that you develop a lot of pain. So it will significantly limit their, number one, the range of motion. Number two is about their strength. And also when they have a lot of pain, it's directly associated as, affect the daily function. That's a big problem. Regardless you treated patient surgically or non-surgically, the goal is to let patient have a speedy recovery and recover to pre-injury level as much as you can. And the therapy is very important because of the range of motion recovery is really important. And because of the injury, soft tissue injury, and you do the surgery, you cut the tissue, and also for the bone, you put the hardware. And all this is another damage to the patient's body. And with therapy, because we have a very good program, we have somebody with called occupational therapy specialized on hand. So they have to get a added quality, pass another examination to get this. So they are very good about it. They reduce the swollen of the edema of the patient. Basically, with all this program, the patient will have early range of motion, function level, and after 8 to 10 weeks of recovery, the patient will have a better range of motion, better function, especially for the older patient. I want to stress this one because when their function level quicker recover to the pre-injury, it's good for everything because they go back to their original level, lifestyle, they're happier, and so they are not going to go down having other associated problems because it will directly affect the whole body.